You are tuned in to Recovery TV, the voice of hope. Discussions and information on addiction and mental health issues. Here is your host, John J. Tassoni Jr., with today's guest.
Welcome to Recovery TV, and I'm your host, John Tassoni. I have two special guests today. Miss Rebecca Young, and she is a certified student assistance counselor in Cumberland High School, and Miss Colleen Judge, who is the director of school-based services for Rhode Island Student Assistance Services. So, ladies, welcome, and thank you for joining us today.
Thank you.
So, Colleen, I would like to start with you, if I may. Very much needed in the schools right now as student assistance counselors. Funding is an issue. Junior high, middle school is an issue. What are your student assistance counselors that report to you? What are they saying that's going on in the schools?
Well, there's a lot going on in the schools now, and I know if you're reading the paper, you're hearing some about it. There was just an article about Providence schools the other day, and the stress that the students are under as well as the teachers. And what they're telling us is that middle school students, there's increasing use of substances among middle school students. They're telling us that the high school students are incredibly stressed, that all students are incredibly stressed, having dealt with the pandemic. I think a lot of people already know that. Anxiety, depressed mood, they're, just the unpredictability of life, and they're self-medicating. That's sort of my way of saying they're using substances, and for a number of different reasons. Some of it being, the messaging that they're getting about substances. Some of it being they don't want to feel what they're feeling. The stress level is so intense right now. So that's what I'm hearing from our student assistance counselors.
Yeah, there's a lot to the stress end of it. Obviously, this will air sometime in April. We have a war going on, which is stressful. We have a possibility of legalization of marijuana, which is really stressful, especially for us here. I got a call here last week about sixth graders who were rushed to the hospital with alcohol poisoning. And that particular individual was drinking with their parents, which is bizarre to me. The whole world is in flux right now. And I can't give your organization, I wish I had $1 billion to give to your organization, because I think student assistance counselors need to be in every school in the state right now. And the issue of COVID, the issue of fentanyl in the schools, the issue of alcohol in the schools, again, I say it all the time, this is a perfect storm for people who have substance use and mental health issues. So I will tell you that in all the conversations I have up at the State House with the finance people about funding your organization, because it's very much needed, and it only broke the barrier last week when that call came in with the sixth graders. I have a grandson who's 7. In a couple of years, he'll be a sixth grader, and I can only imagine if we don't nip this in the bud now, what's going to happen in 3 years. So, Rebecca, we originally met in Smithfield, and now you're in Cumberland.
Yes.
So tell me your job and your day-to-day activity in Cumberland.
Yep. It's a great job. It's really in the forefront of all of this. It's counseling 101. It's getting to know our students. It's getting them to trust us, gaining that rapport, being another important layer of support for these students. Mental health is huge. I know from my experiences, in both schools, that mental health was significant. Kids struggle with being able to cope, knowing how to communicate, how to express what their needs are. Being with COVID,
they were out, then they were hybrid. Some kids got lost in the shuffle because they just couldn't manage some of that transitions. One day they were in, one day they were out, and it was really difficult. And so now this year, with everybody being back in and things getting back to normal, some kids are struggling. Even the mask thing. Some kids have talked about being more comfortable with the mask on. Can't see that gap in my tooth, or my skin is not quite so clear. So they do have a lot of other things that are different and unique to students as opposed to an adult, where adults might not think about those things so much, but the kids are. And it really is about that relationship. I know we had talked about people giving, like, we know that friends, or people that kids know will give them substances. And I had a student just the other day that I checked in for whatever issue, and it came up that they occasionally will drink alcohol, and they reported that my parents know that I do it, but as long as we're being monitored, that opened up a conversation about social host laws in Rhode Island, and what's wrong with doing that, what could be problematic about that for yourself, your peers, and the people that are monitoring, your substance use for a bunch of teenagers that are under the age of 21. So you come across these kind of situations that, just coming in and checking their grades, or just, checking, attendance, it might get missed. We specifically provide that brief intervention where we do SBIRT. We check for assessments of each individual category of substances. We'll ask about marijuana, we ask about vaping, we ask about alcohol, other drugs for getting high, opioids, as you'd mentioned, fentanyl. Huge problem in the state. I just got reports, I've heard that we have more fentanyl mixed in with cocaine, Xanax. So it's important to get this message out, and believe me, we do share this as student assistants. This message is, outreaching through classroom instruction, through our preventative ed series, which is evidence-based, as you might know. And we go in there, we teach classes, bulletin boards, we get guest speakers to come in, and we're just a voice. We're just out there, and we're, intermingling with the kids as much as we can. So, yeah, we're just doing our best to, it's a need. We definitely need us in the schools to help keep this going.
So the $64 question when we come back from break. Parents. You've been watching Recovery TV, and I'm your host, John Tassoni, here with the ladies from RISAS, Rhode Island Student Assistance Counselors. And we'll be right back after this.
I think when you're actively struggling with an addiction, you don't realize the harm that it's causing to the people in your circle, in your family, and your friends. By quitting and getting help, I was able to heal a lot of relationships that were damaged, and you find that people come back to you. Someone used to say to me that it's darkest just before dawn. So if you think that you've gone too far, it's not true. No matter what problems you have, your life can get better if you get help.
The Parent Support Network is committed to supporting and assisting peers. Together, they're working with statewide and national partners to empower children, families, and individuals through dynamic supports, education, and advocacy to prevent abuse and neglect and progress toward universal health, wellness, and recovery. A location is near you. Child and Family Visitation and Training Center in Warwick, Hope Recovery Community Center in Middletown, Hope Recovery Community Center of Washington County in Westerly, or online at psnri.org.
Treatment is often far more successful when individuals are offered both medication and behavioral therapy. Kodak Behavioral Health Care is Rhode Island's largest, only nonprofit, outpatient provider of care for opioid use disorder.
Our compassionate clinicians deliver the highest level of care for patients.
Through Kodak's medication-assisted treatment program, patients are prescribed methadone, buprenorphine, Suboxone, and naltrexone. For a confidential conversation, call Kodak.
Local 57 Operating Engineers is Rhode Island's source for professional heavy equipment operators. For the last 120 years, Local 57 members have worked on all of Rhode Island's major construction projects, including buildings, roads, and bridges. If you're looking for professionally trained and licensed operators to run your excavators, loaders, cranes, or any other type of construction equipment, give us a call at 421-6678. If you're an experienced heavy equipment operator and would like to join our team, give us a call.
The Rhode Island Department of Health reports that drug overdose death is the #1 cause of accidental death in our state. Zinnia Exeter is committed to helping overcome addiction and the silent epidemic of drug overdose, our substance abuse completion rates are over 25% higher than the national average. If you or a loved one is struggling with addiction, call Zinnia Exeter to learn about treatment options.
And now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. My two guests today are Colleen and Rebecca from Rhode Island Student Assistance Counselors. We're talking about issues pertaining to middle school, high school, students, substances, COVID. So ladies, thank you for joining us today. I have a specific question because it's been asked to me multiple times about parents and how parents should approach a student assistance counselor. Because, you know, when we go into the schools, when we talk to the kids, it's always like a standoffish with the parents, because if they approach you, people may hit them with the stigma of, my son, my daughter is having issues, they don't want me to see you talking to you. You know, Colleen and I have had multiple things in Smithfield where we don't have any parent participation because of the stigma issue. So tell my viewers, how should a parent go into a school and approach a student assistance counselor if they're seeing issues at home with their son or daughter?
Great question. Thanks for putting that out there, because we don't only work with students directly. We have access to students. There's 52,000 students in Rhode Island have access to a student assistance counselor right now, and their parents do as well. So they can directly call the student assistance counselor, and on our website is the email address, phone number of the student assistance counselor in their school, and we're in, I think it's 39 high schools and 31 middle schools throughout the state. Not all of them. We still need more, particularly in the middle schools. So a parent can directly access the student assistance counselor. They can call anonymously. Well, I'm anonymously meaning you don't need to tell my son or daughter that I called, I'm worried about them.
Right.
They call their guidance counselor sometimes and say, do you have any resources, do you have any help for us? And the guidance counselor or the school counselor, the social worker, psychologist can make a referral, school administrator, or if a student is caught at a school event, or they're simply worried about their child, they can reach out directly. Sometimes the student assistance counselor is working with the student, and I will say part of our job as counselors is to try to create some access to the parent as well, and try to help the parent. And we're very careful about that, because when you look at the age of students, the older the student is, the more we're going to work directly with the student. The younger the student is, the quicker we're going to access the parent and get them involved. And often the students are really okay with it, and that's part of the savvy, I think, and I know Rebecca's got a lot of experience, the savvy of creating a confidential, private space for a youth to talk about their initiation of substance use or their personal concerns about other issues. And then, that's why we hire master's level counselors, because they're able to navigate those waters well. And, talk with the student about talking with the parent, like if they need something more than just a few conversations with the student assistance counselor. And we need to make a referral out for mental health services or directly for substance use treatment, then we will be contacting the parent ourselves.
You know, you have been in my company a lot, and one of my pet peeves in Rhode Island is the issue of residential care for adolescents. We have zero, other than a few dibs here and there. So we're working very diligently to try to get some of that ARPA money to open up a facility here in Rhode Island, an adolescent facility, and I think it's very much needed. I don't believe that a lot of people know the extent of what you guys do on a daily basis. I do, but You know, that's why I wanted to have you on the show, because, you know, your view, your expertise, people need to know that you're there to help, access to care, access to giving little Johnny the right information so he doesn't drink alcohol, so he doesn't smoke marijuana, so he doesn't take pills. You know, it's just a sad state of affairs that we're in right now that, you know, and I don't mean this to be any disrespectful to anybody, but we're at a point now where every school should have a student assistance counselor, and we weren't that way years ago. So what happened? You know, the influx of drugs and alcohol has risen to the point now where COVID has exacerbated this whole issue. You know, you look at alcohol sales have gone up 234% during COVID. You know, I'm friendly with a gentleman who owns a liquor store in Smithfield, tells me, you know, students come in, buy 6-packs, you know, of age, buy 6-packs, now they're buying cases. Now, instead of 1 bottle, they're buying 2 bottles. So the underlining effect of all of this is alcohol, and we're seeing it in the residential treatment facilities now, again, an influx of people that have got alcohol problems. Now, if you don't nip that in the bud today, that cost of doing healthcare on that individual down the line has gone through the roof. So you guys have a very important job. Not to put any more heat on you than you already have, but, and again, your job along with all the student assistance counselors are very much needed in today's society. And, you know, every school should have one. You know, people in the General Assembly should fund it like they're supposed to, you know, and because if not, we're gonna go back 10 years, and then we got on the horizon legalization of marijuana on top of it, if we don't have enough problems now as it is, and now we're gonna add more to the system without the funding mechanism to help with that. You know, I looked at the 115-page bill, there's no funding in there. So I wanna talk about a little bit more about that when we come back. You've been watching Recovery TV, and I'm your host, John Tassoni, with my guest from RISAS, Rhode Island Student Assistance Counselors, and we'll be right back after this.
My first experience with addiction was actually with a family member. And I was very young at the time. I didn't really understand everything that was going on, but I knew that it really rocked my family to the core. Now, thank God that family member got the help that they needed. Sometimes you get yourself backed into a corner and feel like you've got to do it alone, but I think it's important for those people that are in that situation right now in their lives to understand they don't have to do it alone. You know, you can make it through this, you can get back on track.
I started getting in trouble when I was real young. I was bringing knives to school in the 3rd grade. I started hanging out with the wrong crowds. I envisioned that if I wasn't dead by 26, I'd be in jail. I never had plans past that. Tides give me the opportunity to start a new life fresh. So now to be 28 with 4 children, married, manage this restaurant, living in a house, it's a miracle. Life is incredible, and Tides is who I have to thank for that.
Addiction Recovery Institute, with locations in Pawtucket and Warwick, have been the leaders in treatment of opioid use disorder since 1993. Addiction Recovery Institute offers same-day admission, no waiting list. Services include medicated assisted treatment, detoxification, and substance counseling, always providing care to those who are most in need with dignity and respect. For more information, visit methadone.com.
Alcohol and drug addiction, depression, anxiety, PTSD, they can all seem overwhelming, but you don't have to face them alone. At Trinity Village, we are committed to providing addiction treatment that works. We specialize in offering integrated care for co-occurring mental and substance use disorders. We offer cutting-edge medicated assisted treatment and medication management. We are now offering virtual care to get the treatment you need from the comfort of your home. If you or someone you love needs help, call or visit us online at trinityvillage.org.
With these.
And this.
With my mouth shut.
And my ears wide open.
It means that from the moment you walk into the room,
you're the most important patient to me.
East Bay Recovery Center in Warren connects people in recovery to the supports and activities that make long-term recovery a reality. People with lived experience work to engage individuals and serve as a guide for new recoveries. The Peer Recovery Specialist's aim is to engage high-risk individuals being served in the community to vital treatment and services and follow-up to ensure the connection to treatment and services is maintained. For more information, visit ebcap.org or call 302-6231.
And now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. I have Rebecca and Colleen here from the Rhode Island Student Assistance Counselors, and thank you for what you do, and thank you for joining us today. It's been a very interesting conversation with the kids and the parents. You know, we got legalization of marijuana on the horizon. I know your organization has been vocal about trying to get specific things in the legislation along with the prevention people. We're in a state of serious concerns right now. So are you seeing in Cumberland, Smithfield, or the rest of the people, I don't want to zoom in on one community,
It's
but
everyone, it's everybody.
is it everybody, the kids are using marijuana because they think it's okay, because it's medical?
Yeah, I mean, if I can just kind of add in here, like a lot of interactions in classrooms, especially when when I have more one-on-one into a larger group of kids, they do verbalize that, it's medical, it's medicine, and, I use it for my anxiety, or I use it because I can't sleep that well, or I don't have a great appetite. They're using it, they're getting these messages,
Excuses.
and so, right, and they're looking at it as there's no harm, it's the risk, their view of it being risky is very low. They view alcohol as being riskier than marijuana, and there's a lot of misinformation around the medical marijuana versus what's the non-medical use marijuana. It's the same product, and it's letting them know, they're like, oh, my mom or my dad or my uncle has a prescription, or so it's like trying to educate them around what some of that is.
Yeah,
Give them
well,
that
I
information.
think we're all in it for the long haul.
Yes.
I think, again, student assistance counselors are needed in every school in the state. So hopefully some people in the General Assembly are watching this today, and hopefully that, they have the heart to put it in the budget. And because obviously we're in a very much needed time right now for people to help. Not only are you student assistance counselors, you are probably best friends, and the kids look up to you as individuals in the school. So thank you for what you do. Thank you for coming on today. I greatly appreciate it, and we'll circle back with you hopefully in a couple of months and see how things are going. You've been watching Recovery TV, and I'm your host, John Tassoni. There is hope in recovery, and we'll see you next week.
When people find out that I've been sober for a while, they say, oh, you must have great willpower. The truth is I have no willpower, and that's why I decided to get help. It must take a lot of strength to stay sober. No, it takes strength to ask for help. And once you're done, once you've decided that you don't want to live like this anymore, the real strength and the real courage comes when you ask for help. And then you'll find that people are willing to give that help, and that's when your life can really begin.
If you or someone you know is struggling with a mental health or substance abuse issue, the members of Horizon Healthcare Partners are here to help. Kodak, Community Care Alliance, Newport Mental Health, Thrive Behavioral Health, and Tides Family Services serve the behavioral health needs of all Rhode Islanders. We also operate BH Link, the state's 24/7 behavioral health emergency center. For help, call the 24/7 hotline at 401-414-LINK. For more information, visit Horizon Healthcare Partners at hhpartners.org.
Anchor Recovery has been a mainstay since 2010 and was the first recovery community center in the state. Anchor Recovery has grown from just a couple of 12-step meetings to an entire cadre of meetings supporting multiple pathways of recovery. Today, we support medicated assisted treatment, mindfulness, meditation, yoga, and physical aspects of recovery. Easy access in 3 locations. Learn about how recovery can help you. Different paths, same destination. Stop in, call, or visit anchorrecovery.providencecenter.org.
Serving the community for more than 30 years, 3 generations of our family at Wesco Oil have been providing reliable comfort to your home.
From oil delivery to installation and service, you can trust us to maintain your heating and cooling systems year-round. Visit us at bewarm.com to choose an option that best meets your needs. Be cool or be warm. We've got you covered. Honest service at a competitive price. Wesco Oil Company.
Sometimes everyone can use a helping hand. At Tri-County Community Action Agency, we offer support services when you need it the most. From food and heating assistance to family health and dental care, we have programs to lend a helping hand throughout the whole life cycle. From grandkids to grandmas, individuals or families. If you or someone you know could use a helping hand, visit our website at tricountry.org to learn more about the many services we provide. We know it isn't easy to ask for help. At Tri-County, we are here when you need us. For more information, visit tricountry.org or call 401-351-2750.
If you're struggling with addiction to pain pills or heroin, it's time to call Groups Recover Together. Groups will get you the medicine you need to feel better.
When I took Suboxone, I felt just like able to function, no sickness, no, anxious feeling.
And will give you the support you need to build the life worth being sober for. The time commitment is minimal, just 1 hour a week. You can meet with us in person or virtually. Call now to get started.
When it comes to home improvement, a courtroom is the last place where you want to end up dealing with a contractor. We have all heard the nightmare stories. Avoid any legal hassles and reach out to a contractor you can trust. Lopco Contracting. Interior or exterior painting, small or large repairs, or a home renovation. You'll always get the right verdict with Lopco Contracting. Call Lopco now at 1-800-PAINTING or log on to LOP as in professional, cocontracting.com today. Salute. Adjourned.
Tune in every weekend for a new edition of Recovery TV. Host John J. Tassoni Jr. discusses information on addiction and mental health issues with local leaders in today's recovery world. Tune in Saturday evenings on MyRI TV or Sunday mornings on CW Providence or Fox Providence.